Great. It looks like we have a lot of researchers and analysts, implementers and doers, activists, and other. Well, in the interest of time, let's get started. Hello, I'm Katie Ash. I am co-CEO of Y Labs, a global research and design organization. We've been working at the intersection of climate and SRHR in order to better understand and advocate for work at this intersection. I'm joined today by several co-presenters who will be sharing examples of work that was submitted as part of our research and a landscape assessment across all of South Asia, looking at the opportunities and barriers at the intersection of climate resilience and SRHR across South Asia. I'm joined here today by Anand Sinha, who's a senior regional advisor to the David and Lucille Packard Foundation Global Reproductive Health Initiative, who has based in New Delhi and over 29 years of experience in public health. Reproductive, maternal, child health, and infectious disease, previously led Gate Foundation's primary healthcare initiative in partnership with the government of Bihar, and interestingly started his career as a community forestry professional, working with Foundation for Ecological Sustainability. So lovely to have Anand here today to kick us off with some opening remarks.
Thank you so much, Katie. Great to be here, and thank you for having me in this meeting. I really don't want to take up much time. I think we should be focusing on sort of hearing from the case studies and the data that you have gathered. But I had a chance to look at that. And as a funder, which has worked in the reproductive health space now for several decades, it's becoming evident. I think there's two sort of extremes in the situation that we're facing right now in South Asia. One is that we're kind of overwhelmed by the reality and the everyday nature of climate change that we're facing. It is in our faces. It is not something that is hidden somewhere. Today we're living in an AQI of over 800, where air outside is not breathable. Tomorrow it will be rain. The day after it will be heat. The day after that it will be something else again. It will, sea levels are rising. And I just feel that everywhere I go, we're seeing this at an extreme that we haven't imagined. And I think the problem with that is it makes me personally, and I know many people who work in this field, I feel it's a little bit overwhelming. What are we supposed to do in this kind of a situation? And I think the other extreme of the situation is that there is also very little clarity on what the data says, right? What the data say about, specifically, I think about the issues that we're talking about here, which is, sexual reproductive health. How does it impact those who are most marginalized, typically, again, most invisible from where the data exists and from where the advocacy and the voices might exist. And I think, again, just to say that the work that this sort of landscape reveals is part of a larger growing field, a body of work, right? I think that it's becoming an increasingly busy field, which is a great thing in the Asian and in the South Asian context. We know that there are more and more individuals and groups and organizations who are beginning to sort of try and say, okay, we need to figure out what this intersection of climate and reproductive health looks like. We've made much, much more advances in the intersection of climate and health more broadly, but reproductive health, sexual reproductive health, I think is still some ways to go. And I think the other thing that's important to, and as you look at these case studies, just recognizing that I think some of these case studies are really promising because they're not the usual thing. As a funder, I know that sometimes we're a little bit skeptical. I hear this from many of my colleagues as managers of resources, is that there's a certain deal of skepticism which says that, a lot of what is going into climate and reproductive health is the same thing. It's just being given a new sort of, a new hat or a new covering, but it's essentially at the base of it, the interventions are the same. We're not really doing anything new. And as I was looking at the case study of, the sample of sort of organizations and work that you are looking at, I think it is actually quite interesting and quite new. And the question is, how quickly can we learn from what we're doing? Because each of these is an innovation. Each of these is barely a couple of years old, if that at all. So really, I think sharing more broadly, and thank you for this initiative, which is just trying to get people around that sort of, around the table to talk about this issue, to learn about it, and hopefully then to be able to accelerate the action within the next year or so. So with those opening remarks, thank you so much for having me and really look forward to learning more about this.
Great. Thank you so much. It's always great to have different perspectives in the room. And with that, I'll move forward and share a bit of what the landscape assessment across the region showed. So with this research, we kicked off to understand what really is the policy and funding landscape looking like for integrated climate and SRHR work across South Asia? What does the integrated programming at this intersection look like? And what are some examples of on-the-ground impact and progress that is already being made? We have 4 case studies today that will be the majority of the presentation, and will give you a view of what this is really looking like. We also went into kind of what's missing in the current landscape. What are the barriers preventing organizations from growing, scaling, being successful in ongoing programming, and what kind of support they need? And we make recommendations as well for understanding, based on organizations' perspectives, and what we're seeing across the region, what are some short and long-term opportunities for donors as well as other players to drive impactful integrated work at this intersection. So our methods to doing the landscape assessment in this research, we looked into existing reports and scanned the literature, got to know national policy frameworks across the region. We conducted an online survey that reached over 5,000 individuals. The survey link was opened about 1,000 times. About 400 people started the survey, and we had 106 organizations fully complete their responses with valid information. The in-depth interviews we conducted afterwards with a subset of organizations that had submitted work in the region. We conducted 20 interviews in total, and that fed into the landscape assessment and case studies. The output of these research efforts, conducted by many people over the course of several months, the outputs are a landscape report that goes into policy, work happening across the region, as well as many opportunities, barriers, and suggestions for moving forward. We also created a case study report that highlights 14 different examples of work happening across the region and really tells the story of impact those organizations are already having. I won't go into that level of detail today. Um, at the end of the presentation, we'll share out the link to the reports in the interest of sharing more examples from the case studies themselves. Some quick survey demographics of organizations that filled the survey and were doing work at this intersection. Um, we had 56 respondent organizations that are currently implementing um, or had implemented programs at this intersection. And as you can see, it's quite spread over the region with the majority of programming. The most programs submitted were from Nepal, many from Bangladesh, followed by India, and then Pakistan. Um, there were a total of 68 programs. Many organizations had multiple programs. 63% of the organizations that submitted programming are headquartered in South Asia, and 84% are headquartered in Asia. So this work is really being conducted by majority local organizations that was submitted. Um, Another interesting point to call out is that the majority of the survey respondents were from very small organizations. Nearly half of the organizations that submitted work happening at this intersection have total annual budgets of less than 250,000 USD. And that is for the total organization budget, not the climate-SRHR work. And 79% had budgets under a million annually. Organizations are additionally doing this work on very shoestring budgets. So the total funding for the entire program conducted at this intersection, the case studies and examples submitted, vast majority were under $50,000 USD for the entirety of the program. And many of these programs were multi-year programs. The exciting thing is that a lot of this work is just getting started. It's expanding really rapidly. As you can see, this is basically an exponential growth curve of program completion dates. Of all of the work previous and ongoing that was submitted. Most of it, the vast majority of it is ongoing. And now we'll move to sharing some of the key themes of climate resilient SRHR programming that was represented across the region. One of the first very strong patterns that came out of the programming submitted by the many organizations across the region showed locally led models very strongly positioning women and girls as climate leaders, not as victims, uh, as people to be learning solutions from, and not just to passively receive programming. This was a lot of feminist climate action models, and as a case study, we will share now goes into research that really seeks to understand adaptation strategies that women historically have taken in Pakistan, predominantly through this research, to adapt to local environment through ancestral knowledge.
Hello, this is Jay Das. I work at the Ahan University. It's the Institute for Global Health and Development, and I'm an associate director for this. So today I'm going to tell you about this Institute for Global Health and Development, known as IGHD. It's based at Ahan University across South Central Asia and East Africa. The major reason for its formation was that we wanted to we are medical doctors, have been working in the medical space for a long time now, but wanted to go beyond that and look at the underlying determinants of health. And for this purpose, IGHG was formed, and one of the key areas that we identified we would work on would be the climate change and its impact on health. And this is for very obvious reasons. We all know what the world is going through, and especially in the context of Pakistan, as Pakistan is one of the most vulnerable countries in the world. So we have been working on various aspects of climate change, doing systematic reviews, gap map, field-based trials, cross-sectional surveys, qualitative studies, and all of these, more importantly, have been in the local context and understanding what the local context is, and more importantly, finding ways on how could we build up the adaptation and resilience of the communities at large. Some of the key projects that we have been working on, I would say we have been very fortunate that we have received two, but now just recently I've received the third big Wellcome Trust grant. So these two grants that we have received from the Wellcome Trust grant, one of them is focusing on the impact of heat stress on pregnancy and birth outcomes. It's a flagship initiative of IGHT. And what we are planning to do is this would be a prospective study in which we plan to enroll 6,000 pregnant women very early in their pregnancy, and then follow them up for the entire duration of pregnancy, birth, and 1 year after that. And we want to understand through this, how does heat impact leads to these adverse pregnancy outcomes? And what are the thresholds of temperatures at which these impacts occur? This is very important because in global literature, there's enough literature which suggests now that heat stress leads to low birth weight, preterm delivery, small for gestational age, even congenital deformities and maternal morbidity has been associated. But people don't understand, and there is still scarcity of evidence in understanding what those temperature thresholds are, whether these are acute phases of acute temperature or weather events, or is a sustained chronic effect of heat which leads to these adverse outcomes. So through this study, we plan to understand this, and also we plan to understand what are the pathways, that how does heat leads to these poor pregnancy outcomes. And how are we doing that? We are doing that by doing various assessments, ultrasounds, echocardiograms, Doppler studies, seated blood markers, urine osmolarity. So all of those would be triangulated to understand this. One of the other projects that we are working on is looking at how we can change the environment in which people live and work. So this is the SHAPE study, and it's a randomized controlled trial that we are doing, in which we are trying to understand that how or what modifications could be done which are low cost and could be done in the existing dwellings, both in the urban and the rural settings of Pakistan. Some of the projects that we are working on, one more project that I would like to highlight is looking at the mental health, because we all know that this climate change, especially the extreme weather events like floods, have a devastating effect on the mental health, especially women of reproductive age. So we are doing this study to see how a primary healthcare system can support this woman and at least provide screening and first aid support, mental health support to these pregnant women. So this is a study we are doing in the most vulnerable district of Sindh. And we recently completed that. We are still analyzing those findings, but the initial results are really encouraging. Apart from that, we have also been recently received a grant from Global Affairs Canada, in which we are trying to understand the indigenous practices, because Pakistan has a rich history of those indigenous practices. People have been in the north have been living in below freezing temperatures, and in the south have been living in temperatures above 50 degrees for a long time now. And they have their own ways of surviving those in terms of lifestyles, housing, nutrition, work schedules, But unfortunately, over time, some of those practices have lost. So through this study, we want to revive those. We want to understand those practices, link that up with science, and then project it or disseminate it to the wider audience from the community to the policymakers. So in a nutshell, these are the areas that we are working on. And our ultimate goal is not to just do publications, but also engage with policymakers, both at the national, regional level, and to ensure that all of these initiatives that we are doing can have some meaningful impact in the policy and the lives of the people going forward. Thank you.
Great. Now we will move to our second case study. Another pattern that we saw very strongly represented across the region was that disaster response was often an entry point for integrated action that combined SRHR with climate resilience. This grew out of the fact that many of the organizations working at this intersection are very small, are grassroots organizations, and are truly responding to the needs that are arising from the communities that they're deeply embedded in and already working with. And I'll invite Baitak to now present their case study.
Thank you, Katie. Hi, everyone. So the word Baithak is actually an Urdu word, which means gathering or sitting of people. And that's how we started in 2018 by just creating those gatherings where girls and women could come, ask questions, feel included, where they felt heard, where they could reflect on and ask questions about the sexual and reproductive health and bodily autonomy, especially on issues that were deeply stigmatized. And they could not ask these questions outside those spaces. That's how we started. And that's been the core and crux of our existence, which means that we are a very community rooted and community led organization that works in feminist movement building around sexual and reproductive health and rights. In 2022, Pakistan was hit by one of the worst climate crises in country, which affected around 33 million people. And so many of the communities that we were working with were amongst the most affected. So we started getting a lot of help calls from girls and women we were working with for basic necessities like menstrual pads, because so much of these needs were ignored from the disaster relief. That's what brought us into climate crisis work. And in 2022, we were on ground for around 6 months, like between 2022 and 2023. We were on ground for around 6 months, not only in southern Pakistan, Sindh, where we're headquartered, but across Pakistan. And what we saw was how the sexual and reproductive health and rights needs of girls and women were structurally excluded or not prioritized in the climate crisis response. There was no access to wash facilities, safe wash facilities for girls and women. There were no access to menstrual products. So women were forced to resort to harmful practices to manage the menstruation or even to use toilet. Pregnant women had to give birth in very unsanitary, unsafe flood camps. We also saw an increase in sexual and gender based violence in those flood camps. There was a lot of trauma that a lot of girls and women were carrying. So while our initial response was just providing what girls and women needed, what we also saw and realized that these grassroots needs and realities need to be represented in policy action, in policy spaces. So we started advocating for inclusion of sexual and reproductive health into climate crisis response. So now, whenever a disaster hits, we already have a network of activists on ground who are amongst the first responders, who are not only working on addressing these needs, but also asking questions from the government and holding them accountable to provide sexual and reproductive service in the communities. Again, I think Dr. Jaydas also mentioned that, we are amongst one of the most climate vulnerable countries. So even this year, we saw floods in northern Pakistan, mostly in Gilgit-Baltistan and Khyber Pakhtunkhwa. And Dr. Jaydas also mentioned about, just the variation of temperatures between north and south. Northern Pakistan, especially Gilgit-Baltistan, is also an area that sees extreme cold temperatures, but also has a lot of infrastructural challenges because it's a mountainous regions. So what happens when a crisis hits and the sexual and reproductive health of young girls and women are not prioritized in a region that anyways has so many challenges in terms of accessing basic health facilities, is that when these health facilities are damaged or washed away in floods, it can take years for them to rebuild, which again compromises the access even further. So even this year, we were on ground doing the crisis work. We also saw how the toll that the climate disasters take on women's bodies, whether it is in terms of postpartum trauma, whether it is changes in the menstrual cycles, whether it is the unhealed, the trauma that comes with displacement and loss, how that takes a toll on reproductive health, sexual health, how that's not how that's not studied, not prioritized. So we have been advocating for more research and more funding using the narratives from ground for creating those linkages on bodily autonomy and sexual and reproductive health of girls and women from climate vulnerable communities. Emotional first aid is something that is what we're extensively working on by training first line responders to provide the emotional first aid to affected communities, especially girls and women, because again, I think this is also again something that Dr. Jaydas mentioned, that is one of the most pressing emerging needs in communities that see repeated disasters, but also a need that's not being met, and it has very gendered aspects. On screen, you can see on the right side there's a picture from one of the bethaks that we conduct in our work, where we talk to girls and women about their reproductive health, about their bodily autonomy. We also work on the leadership so that they can take more leadership in the community, especially in the climate space. On the left is a picture from Gilgit-Baltistan, where we have a psychologist on with us who was doing an assessment on the mental health needs of women in the community affected by floods. Can we move forward? To date, we have, through this community-run, community-led model, we have impacted lives of over 500K young girls and women across 48 districts in Pakistan, including the Azad Jammu and Kashmir and Gilgit-Baltistan. I would like to share an example of one of the programs that we have, which is on the next slide, which is Behan Chara Collective, of how we do the community-rooted model. So Behan Chara Collective, which roughly translates into Sisterhood Collective, is a collective that was established by us this year with some generous funding from feminist funders. It's a network of 25 young feminist activists who have been trained by BETAC in different aspects of disaster risk reduction, climate action, policy advocacy, SRHR. Many of the activists were amongst the affected when the recent floods hit, and these girls were the first ones to, or the only ones asking these questions on SRHR, on creating those healing spaces for young girls and women to come and speak about their trauma, to come and talk about their needs, which also then helped us in seeing what is needed on the ground. They were asking questions about gender-based violence, about menstrual health in communities where it's deeply stigmatized. I think that's the power of community-led action, that when you have activists on ground who are well equipped, who have the tools to not only respond, but also hold their governments accountable. They drive a lot of change in the community. On the right side is a picture of one of our Bhanchara collective members from northern Pakistan, who is doing this session with the girls and women from the affected community. I would just like to end the presentation on the note that on the urgency of funding the frontline for the important work at the intersection of climate and SRHR. Back to you, Katie. Thank you so much.
Amazing. It's such incredibly impactful work, and amazing to see Baitak, your organization, really supporting long-term over multiple crises in the regions that you serve, and so effectively working through organizing community that you had already been working very deeply in, and because of that, have been very effective in reaching over 500,000 women and girls. So, congratulations on all of that. A really exciting example of work in the region. Another pattern that emerged across programming happening at the front lines is people who are leveraging existing networks as a force multiplier for impact, working within existing systems, working within existing social structures or programming to be able to reach an incredible amount of people with impactful programming. And at this point, I will pass it over to Shwasti to share their Climate Care Champions program.
Thank you so much, Katie. Thank you for capturing, what we have been doing and how we want to scale the impactful work across India and beyond. So, India is home to 1.4 billion people, which itself says that, the population, such a huge population, is vulnerable to this changing climate. Now, to reach and impact these big mass of population, we need to have a system in place to scale the program with the existing government system. And this is what we try to do. Anyway, like Swasti believes in working with network, with the partners to multiply the impact in short duration of time, because we don't have time. I mean, the way climate is impacting this vulnerable population, we don't have time to, go slowly. We definitely need to have a program which can easily be, multiplied and reach to these many individuals who are vulnerable. So we started this program in the southern state of India, Andhra Pradesh, which typically sees greater than 40 degree of temperature for more than 50 days at a stretch, which clearly makes, these vulnerable population, especially pregnant women, these people with chronic illnesses and, outdoor laborers, highly vulnerable and to climate change, which disproportionately impact these populations. So when we went to the field and we did a baseline study in the state with the frontline workers who are part of the government system, the public health system, which includes the auxiliary nursing midwives, we call them ANMs, and then accredited social health activists. Then we have community health workers. So we have these frontline workers who already is part of public health system. When we went and did the baseline study, we found that there is a huge gap between their understanding of how climate impact the health health of these vulnerable population, and what should they do. And when we went to the community, we clearly saw, hardly 2% of the population said that they are prepared for these, heat-related illnesses or the stress. So there was a clear, gap in the preparation among these frontline workers and also among the community. These frontline workers are already in the system doing the maternal health related work in the communities, and they are trusted member of the community and the public health system. So what we did, our approach is very simple: train the trainers, who then will go to the community and scale the program. So this, after having this baseline study, after looking at what these frontline workers communicated to them, that they know how to work with these women, but they don't know how to relate the impact of climate and how to actually approach if they find any cases in the community. So we come up with these climate care champion programs, which has been designed in collaboration with GCCHE in Columbia universities. What we do in this program is we build the knowledge of these frontline workers. For example, we tell them how to identify severe illnesses among the pregnant women. We tell them, like seizures, nausea, how will they differentiate between mild illnesses and severe illnesses because of heat. And there are a lot of concepts that are being provided during this training, like 3 hours, how to, reduce, rehydrate, and respond to the cases that they see in the field. During this training, we train these FLWs on the maternal and reproductive health and how to recognize heat stresses impacting, pregnancy, fertility, menstrual health, and newborn care. This program, the best part of this program is this is not being done, all alone. This is being done along with the government, which itself makes it scalable and adds to the credibility of the program. So at present, this program is being led with, government of Andhra Pradesh, which plays a central role in organizing and facilitating all kind of trainings for these frontline workers. They take care of all the expenses related to the trainings, and they ensure that these frontline workers are going to the field. Anyway, they go to the field. So it is not again any additional work that they are doing. We are not overloading them with additional work. They are anyway going to the community, talking to these community members. It's just that they now are equipped to understand and differentiate what is the mild illnesses, what is the severe illnesses, if it is because of the heat, all those kind of tools they have, and they respond properly. So recently we also conducted Endline, and the result is very impactful. We have various testimonies also from these frontline workers and also from the communities. So they say that anyway they go to the field, they talk to the individuals weekly, twice, thrice. But earlier they were not sure, how to respond. Now they are confident and they are responding really well. We have also seen increase in identification of heat-related illnesses and increase in the number of individuals, referring to the hospitals. So we are seeing changes, and we also now see that communities are well equipped, aware of how to take care of themselves also during these heat stresses. Till date, if I talk about the trainings, we have 90 master trainers that we trained, and these master trainers again are part of public health systems. We have like CHOs, as I've said, like the doctors and these ASHAs, ANMs, who then have trained 2266 frontline workers across 71 primary health centers. And through these frontline workers, the trained frontline workers, we have reached an estimated 4.57 million people, as you have written here, Kitty, with life-saving health preparedness messages. The training during the training, we have seen increase in the knowledge, almost 57% increase in knowledge of how do they identify the symptoms, how they respond. So now they very well know how to relate, this heat stress. And women have also reported adapting to the daily routine during the pregnancy, during this FLW's awareness sessions. And the data that we are gathering through this baseline, endline, and during the interactions, the district administration requested us to, come up with the district level heat action plan and incorporate the grassroots knowledge into that, making it more impactful. So we have come up with the district level heat action plan as well for the district, and we are finalizing it along with the government. So our approach is very simple, but yes, it is deep rooted into the government system, which itself makes it sustainable. So even though we are not there, the individuals has been trained, they have the heat action plan, and we ensure that we are not leaving these trained individuals all alone and it is one time training. No, we are also have collaborated with IACO, and we continuously routinely ensure that they are getting the refresher trainings, and the hand holding support is always there. So we see what are the system that exist in the government, and we try to add these components, making it more sustainable. Over to you, Kitty. Thank you.
Awesome. I love this program so much and the work that you have been able to do through integrating into the public health system. We get questions, since we do this work globally, we get questions so often about programs that in my mind could learn so much from this approach. And especially, knowing what we know about all of the impacts that heat particularly has on pregnant women, infants, preterm birth rates, just how incredibly important this work is. Great. Moving on to our final case study. So another pattern coming out really strongly, frontline organizations are generating a lot of localized data on gendered climate impacts, and subsequently using that data to drive programming, and ultimately driving policy change as well. I'd love to invite Environmental Protection Training and Development Organization in Afghanistan to share our next case study.
Thank you so much. First, I continue my speech. Am I audible?
Yes, perfect.
Okay, all right. The Environmental Protection Training and Development Organization is a national NGO. It is based in Afghanistan. And of course, before I start, I will introduce shortly myself. My name is Abdul Hadi Achakzai. I am founder and CEO of this organization. And this organization was established in 2019 by a group of male and female experts. And actually, we work to build the resilience of those communities who are impacted by climate change. And we also protect the environment through different initiatives, specifically through climate change adaptation, mitigation, as well as disaster risk reduction, biodiversity, and women inclusion in our organization. So we also have a huge number of volunteers within our organization. Actually, in 2019, the first thing we established was a huge volunteer network of volunteers. We registered 1,500 active volunteers in our organization, in which 680 are female. We lead or we conduct climate resilience and women health awareness workshop across the country, and we are covering different regions of this country. And we also conduct the same programs in remote areas, provinces, and different issues. So the work we are doing is specifically, we have been working with different donors, and of course, we have conducted several research specifically on how climate change is impacting women. As you may all know, that Afghanistan is among the top vulnerable countries from the chronic challenges of climate change. And of course, this country has been suffering a lot, specifically marginalized groups, specifically women and children. They are the most people who are suffering a lot. So we have been implementing several projects in different areas. One of our projects was a case study as an assessment focused on climate change impacts on rural women. That project was implemented in Badakhshan province. Badakhshan is one of the remote provinces of Afghanistan. So we actually facilitated a provincial consultation as well as with the government authorities, different authorities from different departments, and in which UN agencies, international organizations, national organizations also participated. And we actually highlighted the most pressing issues that we collected from Wiawan and Kohistan districts of Badakhshan province, and we shared the key findings that how the climate change is impacting women, specifically those pregnant women who are suffering a lot from different diseases. So in this case, when we shared our case study, our research and our key findings, so we received some commitments from the communities, even from the specifically from the authorities, that while we shared these key findings, they mentioned that of course these rural areas are really suffering a lot, and they committed that they will reach out and they will activate some of the clinics, because in the findings, one critical issue was that when there is seasonal issues like raining, flash floods, and other things related to climate change or natural disasters, so the women access to clinics is breaks. So the women do not have access to clinics, and but even we lose lots of women during pregnancy and during childbirth and birth and other healthcare issues because of their communication and their access to clinics, to doctors. So in this case, we also have conducted several other assessments. One of our assessment was also together with Geneva CAL organization. Geneva CAL organization is a Switzerland-based organization and working in Afghanistan. We also covered 17 provinces of the country, and we also had one specific issue on how climate change is impacting rural women and how what are the main solutions. So then we are addressing all these key findings in different sessions, in different events, specifically in consultation sessions with the authorities, with the international, national NGOs, stakeholders, to share the key findings and find solutions and share the solutions with them. So these are our work. As you know, Afghanistan is one of the most vulnerable countries, and in this case, we are working to do a lot, and of course, this needs a lot. So the impact we have created up to yet, of course, through different our initiatives and programs, we engaged thousands of beneficiaries directly, and we provided them public awareness programs, and we conducted several campaigns and several educational and capacity building programs to increase the knowledge and to build their resilience actually through different awareness programs, because most of the villages, most of the cases, while there is any kind of natural hazards, they do not know what to do. So in this case, specifically the women who have different health related issues, we provided them public awareness programs, as well as our organization is climate change focused organizations and covering different regions of the country. In this case, we conducting different kind of sessions with the different people, different communities, and we also conduct focus group discussions with different communities to inform them and to take information from them, and then share the key findings with the institutions and relevant stakeholders to take actions. So these are the key topics, key issues that we are covering, and currently we have projects with UN, and we are also an UNFCCC, UNCCD, UNEP accredited organization, and in every CAP conferences of the parties, we are trying to provide more public awareness, to provide more information to the participants regarding the vulnerability of this country, specifically how our country, specifically women, are suffering from these chronic challenges of climate change. So in this case, we will be conducting more sessions and more assessments on women, and currently we have UNDP projects, United Nations Development Projects, and we will be building the resilience of those communities who are directly impacted affected by climate change, and the projects are focused on livelihood projects in which we are making the livelihood, and we will be building a greenhouse and installing greenhouses where to stable their products and specifically in fruit. So these are the things that we are doing currently. Thank you.
Amazing. I think it's such incredible work that's being led through your work, through your volunteer network, and that you've really impacted local policymakers to change access to healthcare for women in areas that were shown to not have enough connectivity and to have particular climate vulnerability. The last pattern, which you heard some of through case studies shared today, but was an incredibly strong pattern across the programming happening at this intersection, is that policy advocacy is really happening as a norm across organizations working at the climate-SRHR intersection, which is really impressive that advocacy work is happening, especially in the context of what we mentioned earlier about organizations having such really limited shoestring budgets for what they're doing. 69% of the organizations that reported work at this intersection have an explicit policy advocacy component to their work. And this was really regardless of size of the organization. Many of the large INGOs were doing policy advocacy work on very, very local levels. A lot of small grassroots organizations are finding it important to go to COP and do large international advocacy actions. This is something that we heard from almost everyone in the space. It's just the incredible urgency behind this work, and the impact that these models are having, the rapid increase in that work. But as you all know, South Asia is billions of people, and the work needs to really, really grow in order to make sure that women and girls are not disproportionately and horribly impacted by the changing climate. Just really quickly, some of the opportunities we suggest in the report, and you can read more about the next steps we're suggesting, but really stabilizing and strengthening frontline organizations that are doing incredible work in communities to disseminate those programs and build the resilience of women in the community, creating regional and thematic pooled funds that allow work to be happening in a better funded way, to be reaching more organizations in the grassroots, and to be collectively organizing and sharing learnings across sectors, across the region, for impactful models, measuring what matters, showing the impact that these approaches can have, conducting research like IGHD on why this work is so incredibly crucial. And then resource coordinating more of the advocacy work that is already happening. As mentioned, the vast majority of organizations are already doing advocacy work. By a little bit more funding there, a little bit more coordination there, a lot of impact could be unleashed. And just so you have resources, this is just a tiny tip of the iceberg of the case studies and the landscape report findings that were